My name is Selena. I'm doing my head to toe assessment, and this is my empty sheet. Hi, my name is Selena. I'm going to be your student nurse from Saginaw Valley State University. Can you give me your name, date of birth, and any allergies?
My name is Lainey, 4/14/2004, and I don't have any allergies.
Okay, great. Do you know where you are today, Lainey?
Saginaw.
Do you know who our president is?
Joe Biden.
And do you know today's date?
April 10th.
Okay, great. So today we'll be performing a head-to-toe assessment on you. Is that okay?
Yep.
I'm just starting with your head and assessing all the parts of your body all the way to your feet, okay? But first I'm going to start by asking you a couple of questions to get a brief health history. So first, do you take any medications right now? Any supplements?
Nope.
Do you have any current or past diagnoses I should know about?
No.
Okay. Is there any significant family history I should know about?
Nope.
Any past surgeries?
Nope.
And what about your diet and exercise? How's that?
I'm pretty active, so both are pretty good.
Okay, good. Are you in any pain today?
Nope.
And do you smoke or drink?
No.
Neither?
Nope, neither.
Great. Now that I have all of that out of the way, I'm just going to get a quick set of vitals on you, okay?
Okay.
I'm going to start with your blood pressure. Do you have a preference on which arm?
My right arm's fine.
Okay, great. (122/92), which is pretty normal, so you're good. Okay, now I'm going to take your pulse. Do you mind if I sit next to you?
Nope.
Okay. Okay, respirations were 66. Heart rate was 66, respirations were 18, so those are both normal. If I had a thermometer, I would take your temperature right now, which I'd expect to about 98.6, as that's normal. And if I had a pulse ox, I would take your oxygen saturation, which we'd want to be about 98, 99, 100, okay? So now that we've done all of that, I'm going to just first check the symmetry of your pulses, so I'm going to check your radial pulses. Okay, everything's symmetrical there. Everything's symmetrical there. I'm going to look at your hands really quick. I'm just looking for any clubbing, which I don't see. I'm checking capillary refill, which color is coming back in less than 3 seconds, so perfusion is good. Everything's good there. Now I'm going to assess your arm, so I'm going to just look at your right arm first. Just looking at the color, looking for any freckles, moles, dry skin, which you really don't have any. Color is good, temperature is good. Left arm. Everything feels good there, good color, good temperature, and again, no moles or scars, anything like that. Now I'm going to feel for muscle symmetry, so I'm just going to feel these both at the same time. Everything seems symmetrical there. While we're here to also test your muscles, your strength, I'm going to have you grab my hands, good, and then I'm going to have you push against my hands, good, good. To test some range of motion, I'm going to have you do a swimming motion, good, everything's good there. Now again, okay, everything seems good there. I'm going to have you put your shoulders back, forward. Okay, that was again testing some range of motion. Everything feels good there. While we're here, I am going to have you do test your coordination, your cerebellar function. So we're going to have you make an okay sign and just go like this and as fast as you can. Good. Now here, flip over, back as fast as you can. Good. Last one, I'm going to have you touch your nose, then touch my pen light as I move it, okay? Sorry. Good. So you're very coordinated. That everything looks good there. While I'm still here on the front, I'm going to look at your trachea, the alignment of your trachea. I'm going to have you swallow for me. Okay, everything looks good there. I'm going to check your tissue turgor on your clavicle for hydration. No tenting present, so that looks good. And then again, while I'm here, I'm going to listen for bruits in your carotids. So when I do this, I'm going to be listening with the bell of my stethoscope, and I'm going to be listening for any abnormalities, any whooshing sounds, which would be of concern. When I do this, I'm going to ask that you hold your breath, okay?
Okay.
Okay, good there. Good, thank you. And then I'm just going to feel your carotid pulses one at a time. Good, strong pulse. Good there. Those seem pretty symmetrical. Everything looks good there. And I'm going to move on to your head, okay? So, head looks symmetrical. Do you dye your hair?
No.
Do you have any problems with dry skin?
Nope.
Okay. I'm not noticing anything, concerning. Do you have any pain when I'm, touching?
Nope.
Seems symmetrical, no bumps, nothing I'm concerned about. While I'm here, I'm going to palpate your occipital lymph nodes, post-auricular lymph nodes, pre-auricular lymph nodes, submandibular lymph nodes, submental, your cervical chain, and then I'm going to have you just move your shoulders. Perfect. This is your supraclavicular lymph nodes. All right, those were not palpable, which is good. If they were, we'd be concerned of some infection of some sort, but they weren't, so everything's good there. So head symmetrical, everything looks good there. We're going to move on to your face, okay? So looking at your face, everything seems symmetrical, looks good. Do you have any dry skin or anything?
Nope.
Good. I'm going to palpate your sinuses, first your facial. Any tenderness?
Nope.
Then maxillary. Any tenderness?
Nope.
Okay. I'm going to be testing your cranial nerves 5 and 7 on your face. So first I'm going to have you clench your jaw. Now open your mouth. Okay, and then I'm going to have you make a couple of faces for me. So can you smile and then frown? Okay, so that was testing the motor function of cranial nerves 5 and 7. Now I'm going to be testing the sensory function. I'm going to be poking you in a little spot on your face and just tell me where you're feeling this, okay?
Forehead. Left cheek. Chin. Right cheek.
Good. So 5 is good, 7 is good. Now that I've done all that, I'm going to move on to your eyes. So first I'm going to pull down on your eyelids and have you look up. Good. And now I'm going to do the opposite. And then we're going to go over to here. Again. Okay. Conjunctiva and sclera look good. Now I'm going to be testing the motor function of nerves 3, 4, and 6 with the 6 cardinal fields of gaze. So I'm going to have you follow my pen light with just your eyes, okay? Good. Any pain with that?
Nope.
Okay. And then I'm going to be testing your pupils. I'm going to be looking at that they're equal, they're round, they react to light, and that they accommodate. So when I do this, I'm going to be shining a light in your eye. Do you wear contacts or glasses?
Nope.
And do you have any light sensitivity?
No.
Okay. So when I shine this light at you, I just want you to look straight at me. Good. Good. Pupils constrict as you want them to, so everything looks good there. Now I'm going to shine this right at your nose. I'm just going to have you look straight at me again. I'm just going to be testing that the reflection is symmetrical in your eyes, okay? Good. Everything looks good there. Now I'm going to test that your eyes are accommodating. So I'm going to have you look at my pen light, then look at my finger, pen light, finger, pen light. Good. Pupils are moving, accommodating to the distance. Everything looks good there. And then they look symmetrical, they're even, everything looks good there. So now I'm going to look into your nose. I don't know why I keep doing this way. So I'm just going to look into your nose. Mucosa looks good, turbinates are there, no polyps, and no deviated septum. Yep, everything was good, good color. Now I'm going to be testing cranial nerve 1, which is your sense of smell. I'm going to put something in front of your nose. I'm just going to ask you to tell me what you're smelling, okay?
Soy sauce.
Yeah. Okay, so that's all good. Everything's good there. Now we're going to move on to your mouth. So first I'm going to have you stick your tongue out and then move it around. Okay, so that was cranial nerve 12. Everything looks good there. Now I'm going to have you open your mouth big for me. I'm just looking at teeth. I'm looking at the palates. I'm looking at the tongue. Color looks good and very hydrated. Mucosa looks good. Everything looks good there. Now I'm going to test cranial nerves 9 and 10, and I'm going to push down, or have you stick your tongue out, say ow as I push down on it, and we're going to watch as your uvula is moving. Good. Palates and uvula are both moving. Everything looks good there. So everything looks good. Lips are symmetrical. Maybe a little dry, but that's no issue. Everything looks symmetrical in the face, so we're going to move on to your ears, which ears look aligned to me, so I'm going to scooch over here. Just feel them. Good color, good temperature, and you have some piercings. How long have you had those?
About 2 years now.
They've given you no problems?
Nope.
Good. Everything looks good there. Now I'm just going to look for any obstructions in your ears. No, nothing there. Nothing there. Okay. So now that I've done all that, I believe we're ready to move to the back. Okay. So I'm gonna first start by looking at the skin on your back, which again, great skin, good color, good temperature. I'm gonna have, or test your lung expansion. I'm gonna have you take a big deep breath in. Good, everything's good there. The ratio is even 2 to 1. That looks good. And now I'm just going to palpate your thyroid. So I'm going to start on the left side, scooch it over. Okay, feels good there. Now I'm going to move to the right side. Good. Okay, now that I've done that, sorry, I'm over here again. I am going to listen for lung sounds, okay? Mm-hmm. There's 12 spots I'm going to be listening to. And each time my diaphragm is hitting your back, I'm going to ask that you take a big deep breath in. This can be tiring, so if you do get tired, just let me know and we'll take a break, okay?
Okay.
I'm going to move your bra. Last one. Great. I heard clear lung sound, so that's good. No concerns there. Now, again, in the same 12 spots, I'm going to percuss, listening for resonance. If I heard a dull sound, I would be concerned that there was fluid or some type of mass in your lungs. So we're just going to start up here again. I'm gonna move your bra again. Okay, everything's good there. I didn't hear anything dull, so I'm not concerned. Now that we've done all of that, I believe we're ready to lay down. So I'm gonna have you lay down, and then I'm gonna remove your pillow quickly, and I'm gonna ask that you look to your left. Here I'm looking for any JBD, which I don't see, so that is not of concern to us. Would you like a pillow?
No, thank you.
Okay. We're going to move on to your chest. Do you want to be covered up at all?
Oh, no, it's okay.
Okay, so I'm just going to remove this. Sorry. And I'm just looking at your chest. Good chest expansion. Everything looks good there. I'm going to feel temperature, color. Color looks good. Temperature is good. All right, everything's good there. So now I'm going to be listening to your heart sounds in 5 different spots. I'm first going to listen with the diaphragm for your normal heart sounds, your lub dub. And then I'm going to be listening to with my bell for any murmurs, which would be extra heart sounds that we don't want to hear. So I'm going to start with your aortic. Clavicle, first rib, space, second rib, second space. Okay, I hear lub dub, so I'm switching to my bell. No murmurs there. All right, now we're going to do pulmonic. Clavicle, first rib, space, second rib, space here. Good, I hear lub dub again. Switching to the bell. No murmurs there. All right, now your herbs point. Clavicle, first rib, first space, second rib, second space, third rib, third space. I hear lub dub, switching to the bell. No murmurs there. Now your tricuspid. Clavicle, first space, second space, third space, fourth, just under your bra, fourth intercostal space for tricuspid. I hear lub dub, so I'm going to switch over to my bell and get under the bra again. No murmurs there. Now for your mitral, I'm going to listen for lub dub, listen for murmurs, and then I'm going to get your apical pulse for 1 minute. That's where we can best hear your heartbeat, so
Okay.
most accurate. Clavicle, first rib, first space, second rib, second space, third rib, third space, fourth space, fifth space, mid-clavicular, so we're going to scooch over. I'm going to move your breast tissue a little bit. I'm hearing lub dub, so I'm switching to the bell. Again, I'm going to have to move. And I hear no murmurs. Back to the diaphragm to listen for a full minute. .74 beats per minute. So that's pretty good, normal. So we're all done in the chest. I'm gonna cover you back up. Again, I'm gonna ask, do you want to be covered up as I go to the abdomen?
Nope, that's good.
Okay. I'm gonna lift this up, pull the shorts down. Great. So I'm just gonna inspect the abdomen first. I'm just getting down to eye level. I see the aorta palpating, and I don't see any abnormalities, no masses, no lesions, nothing like that. Everything looks good there. So I feel like I'm ready to listen. I'm going to listen for bowel sounds in all 4 quadrants, starting in your right lower quadrant. I'm going to be listening with my diaphragm for these. Okay, bowel sounds are present, so everything's normal there. Oh. While I'm still listening, I'm going to listen with my bell for any bruits in your arteries. I'm going to start with your aortic, then go to your renal and your iliac. Listening with my bell. Now your renal. Other renal. Iliac down here. And your other iliac. No bruise present there. So I feel comfortable to move on and percuss your abdomen. So I'm going to percuss in all 4 quadrants, listening for tympany, okay? Everything sounded good, nothing dull. Now I'm going to be listening up to your liver border. So we're going to start in your right lower quadrant, move all the way up into just under or just before your ribs, where we expect the liver to be. We want to hear dull where your liver is, okay? Perfect. So that sounded normal. Liver's in the right spot. Everything looks good there. Now I'm going to palpate your abdomen. I just need you to let me know if you feel any pain with this. I'm going to start with light palpation first. No pain?
Nope.
Okay, I don't feel anything abnormal. I'm going to do a little bit of a deeper palpation. No pain?
Nope.
Okay, everything's good there. So I feel good about the abdomen. We're going to move on to the legs, starting with the femoral arteries. So similar to the ones we did in the abdomen, I'm going to listen for any bruits with my bell, and I'm just going to palpate them for symmetry as well. So I'm going to start by, asking you to move your leg just out a little bit more. I'm just going to feel. Okay, I feel that, so I'm going to listen for any bruits with my bell. I don't hear anything there. So now we're going to, perfect. Okay, gonna listen with my bell again. No bruise. Now I'm just gonna feel both pulses at the same time, just to note symmetry. Good, those pulses are symmetric. Okay, so now we're moving on to the legs. I'm just gonna feel your legs. Color looks good. Temperature feels good. A couple of scars, but I know you play soccer, so not really concerned. I don't see any edema in the legs. There's no pitting, so I'm not concerned about any fluid in your legs. Okay, now I'm going to move on to feel symmetry in your pulses. I'm going to start with your popliteal pulses. Okay, those are symmetric. We're going to move on to the posterior tibialis pulses behind. There we go. The ankle bone. Okay, those are symmetrical. And now finding your dorsalis medius pulses on your tops of your feet. Those feel symmetrical to me. Okay, so one of the final things I'm going to do on your legs is I'm going to be testing just a sensation. So this is sharp. This is dull. Okay? Just wherever I'm touching you, let me know if you're feeling sharp or dull. Okay?
Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Dull.
Good. Okay, everything is good there. So I feel ready to sit you up now. Just gonna have you turn. I'm gonna do your patellar reflex, okay? Good there. Sorry. Good. Good reflexes. I already noticed symmetry in your muscles when I was just inspecting your legs, but now I'm just gonna test a little bit more strength. So I'm gonna have you push against my hands, push down. Okay, and then push up. Good. So strength is there. Everything's good there. Now I'm gonna get you your shoes. We're gonna put your shoes on before we stand you up. Sorry. Do you want any help?
No, it's okay.
Okay. Good. Okay, I'm gonna have you stand up. I'm gonna test your Romberg. So I'm just gonna note if you're having any off balance. I'm gonna have your arms to your sides. Perfect. Stand with your eyes closed for about 15 seconds. Okay, that's good. Not too much swaying, so that would be a negative Romberg. I feel ready that you're capable and able to walk. So we're gonna walk over here. I'm gonna test your gait. I'm gonna just have you walk normal, just down, and then turn around and come back, okay? I'm gonna walk with you in case anything happens. Turn, good. Great. Now we're gonna walk heel to toe. And then turn around. Good there. Okay, so that you have good gait, you're ready to walk around, you're all good. So I'm finished with my head to toe assessment. Everything looked good. The final part of it is that I'm going to give you a Braden scale score, which is your risk for pressure ulcers. Considering you are mobile, you play soccer, you're active every day, your skin integrity is good. I'm not concerned about any moisture, and you have a good diet. I'm not concerned about pressure ulcers, and I'm going to give you a 23, which is a perfect Braden score scale.
Thank you.